Hello, this is Dr. Richard Sollazzo. I am a board-certified internist hematologist oncologist. I'm going to be talking about insulin potentiation therapy, also called IPT, insulin potentiation therapy. We know that cancer loves sugar, and it is now in mainstream oncology books that we use a thing called a PET scan to pick up cancer. A PET scan is based on the fact that cancer loves sugar. The molecule that they inject the patient with is 18-fluorodeoxyglucose. 18-fluorodeoxyglucose. The 18-fluoro part of the molecule fluoresces. And I'm going to make this simple smart. The redder it is, the more likely it's cancer, not scar tissue, not a cyst. And it gets deeper. SUV, standard uptake value, if it's 4 or more, it's usually cancer. So that's the 18-fluoro. The deoxyglucose part of the molecule gets it just into the cancer cells. So it's a worm on the hook. The worm is the glucose part of the molecule, and the hook is the dye, the 18-fluoro, what fluoresces. We also know that people that are obese, according to the World Cancer Research and also the American Institute of Cancer Research, people that are obese are prone to more than 12 different types of cancer. So sugar can increase cancer. Sugar can feed your cancer. Is it the answer of the answers? No, but it's part of the puzzle. It's part of the puzzle. So the concept of sugar, or the fact that sugar increases cancer, there was a great article in the New York Times, April 13th, 2011, Is Cancer Toxic? Written by Dr. Gary Taubes, Taubes. And it showed that a city in Antarctica from 1965 to 1987 had only 2 cases of breast cancer. Then we exported our most deadly export, sugar imploded foods. Their cancer incident rose to exactly what ours was. And back then it was 1 out of 8 women got breast cancer. Now it's 1 out of 7. So cancer loves sugar. So we have to remember that. Now cancer cells have many, many more insulin receptor sites on their outer membrane. In fact, Alabaster in the European Journal of Cancer back in 1981 showed that the MF7 breast cancer cell line, had 1,000 to 10,000 more insulin receptor sites. So an insulin receptor site is like a door into the cancer cell and a door into a normal cell. So you can open up 1,000 doors if you give a little bit of insulin before you give medicines, such as chemotherapy, such as alternative IVs. So you give a small and safe amount of insulin under the supervision of a doctor, and you then give the medicine, and then you have the patient eat a sugary food. The sugar pushes the medicine through the door that insulin opened. And cancer cells, again, have 1,000 more insulin receptor sites than a normal cell. So you're opening up 1,000 doors as opposed to 1 door, and you're pushing it through the door that insulin opened with sugar. You can then be a heathen and have your banana, organic cookies, or whatever. There's lots of articles showing that cancer cells have more insulin receptor sites, that they love the glucose, sugar. Home in 1990 in the University of Heidelberg showed that cancer had 30 times the avidity to glucose and produced a lot more, in fact, 43 times the amount of lactic acid than a normal cell. So that tells us two things. 30 times the avidity for glucose, 43 times it produces lactic acid. So cancer loves an acidic environment. And Dr. Warburg, a Nobel Prize winner in 1931, showed that cancer loves an acidic environment. So that's another thing to deal with. So insulin potentiation is a targeting system. It helps the medicine get into the cancer cells, less into the normal cells, therefore less collateral damage. The Cancer Research Journal 1983 and 1990 also discussed insulin receptor sites, and you can check this all out online. So the point is, insulin potentiation can target the medicine into the cancer cells, less side effects, more cancer cell kill, and it's very good to use in patients that have had lots of chemotherapy, radiation, and they cannot tolerate full dose chemo. And there are books about this, and the kinder, gentler cancer treatment discusses this in detail. Insulin potentiation has quite a few references. This book is very well referenced, more geared to the scientist, the doctor. So the first book, The Kinder, Gentler Cancer Treatment, if you're a lay person. If you're a doctor or scientist, this would be the book. I wrote a book and I discuss insulin potentiation and other things. The book is mainly about cancer. There's some things about cholesterol and other things. So insulin potentiation therapy is a double-baited system where you target the cancer cells, you open up the cells with a small amount of insulin, then you give the selected medicine or other alternative treatments, and then you give some sugar. The patient can eat sugary types of food, like we talked about banana, pineapple, melon, juice, organic cake, cookie, whatever. And the sugar helps kick the medicine through the door, insulin open, a double-baited system, a Trojan horse, a worm on the hook. And I've seen some good effectiveness from this method. It's not the only thing you do, but it is part of the treatment method to help get the cancer cells killed by targeting them directly. If you have any questions, concerns, let me know. The phone number here is 631-361-6160. Again, 631-361-6160. Take care.